Hello, my name is Brandon Blanford and I work at a large university hospital where our motto is every patient every time, whether it be a sickly kid or a patient who has overdosed 3 times, they are treated equally. The opioid epidemic is impacting the world around us each and every day. Not only is it affecting our neighbors, family, friends, and patients, but it's also affecting ourselves. We all can reflect on a person that we have encountered and categorized into one of the previously stated groups that has been impacted by opioid abuse. Each day, as a nurse, we are enabled to be introduced to people who have made negative decisions that have impacted their life. Whether their decisions be unhealthy dietary choices or drug abuse, we have to take care of the patients equally. The opioid epidemic continues to become a problem even in cardiovascular units. This past week, I took care of a patient who had a history of IV drug abuse and using heroin, which caused her to overdose. Narcan was administered at the scene, and the patient was able to regain consciousness. But after doing an echocardiogram of the heart, they found the patient was impacted with endocarditis, a tricuspid valve regurgitation, and a ventricular septal defect, while also experiencing stroke symptoms due to septic emboli. Patients are being impacted by opioids due to the decision to begin using them, but I do believe it is because they have pain in their life that they cannot fathom with. As a nurse, we are told to keep our personal lives to ourselves, but it isn't always the case. Due to the magnitude of the opioid epidemic, nurses are inclined to have preconceived opinions and about drug abusing patients, and the nursing care is impacted due to it. We as humans tend to try and escape from the pain in our life, whether it be physical pain, back, shoulder, neck, or psychological pain, like negative views of ourselves, which can be a result from sexual assault or to emotional abuse. The coping is hard. For some people, it may mean hiking, running, or spending time with family, which are all socially accepted forms of coping. But we have a problem when drugs are involved. As a nurse, we are alleged to educate patients on their diagnosis, medications, and to be an advocate for patients in communicating with healthcare professionals. To educate, that is the biggest part of our job duty. If each employee would educate patients on the alternative forms of pain control rather than giving opioids, there could potentially be a decline in deaths per year and lower level of drug abusers. In a recent article that was published in the New York Times by author Margot Sanger-Katz, she discusses the new estimates in the drug epidemic. In the last year, 72,000 Americans were pronounced dead due to drug overdose. This is a 10.2 increase from the year before, having a death toll greater than HIV, car collisions, or gun-associated death. She informs readers in the article about a major reason for the increased death. One being that there is a growing number of Americans that are using opioids, and 2, drugs are becoming more deadly. In the article discussed, she tells that there is a difference in the rates across the United States and how drugs are created differently. In states at the west of Mississippi, heroin is becoming distributed that is processed into a form known as black tar, which is difficult to mix with synthetic drugs, and the heroin that is sold east of Mississippi is processed with white powder and is easily combined with fentanyl. This enables the West to have higher rates of overdose. In the year of 2017, Donald Trump declared an opioid crisis as a national public health emergency, which used a $1.0 billion grant to help fight the problem, according to Sanger-Katz. The news article also discusses a government phone survey that was initiated. Around 2.1 million Americans had agreed to opioid abuse in the last year, which was in 2016. Due to not all drug abusers having a phone to participate in the survey, this number isn't 100% accurate, meaning the number could be greater than 2.1 million. Some of the opioids that were being reported to cause overdose when mixed with fentanyl, are heroin, cocaine, meth, and even benzodiazepines, which are used for anti-anxiety medications. The news article informs readers about how there is a change in the combination of opioids and how even a person who abuses the drugs regularly can still have unexpected complications. The Americans that have the highest rate of death are older, urban African Americans who have used IV drugs before. Higher than the national average, Ohio, Indiana, and West Virginia, their death rates of overdose have increased more than 17% in each of those states. In New Jersey, it has rose to 27%. So, what is the United States doing to prevent the opioid deaths? In the U.S., they have started a state funding to help develop public health programs. In Dayton, Ohio, for instance, they have instituted a new emergency response strategy, and since the start of it, there have been a reported reduction in overdoses resulting in death and a decrease of ER visits and ambulance calls by more than 60%. Dayton has reduced medical opioid prescriptions, increased addiction treatment resources, expanded their community access to naloxone, and provided addiction treatment to prisoners in the county jail. We could educate patients on the alternative forms of pain management that do not require a drug, and that would help. When a person experiences pain, they automatically think that they need to take some type of medication, whether it be ibuprofen, Tylenol, oxycodone, Percocet, or any other types of drugs. They just forget about the non-opioid alternative form of pain management. Some are acupuncture, massage, exercise, and chiropractic therapy, just to name a few. One in particular I want to discuss is chiropractic therapy. I chose to discuss chiropractic therapy due to it having a huge impact on my mother's life. My mom has had chronic back pain due to degenerative disc disease, and she is a big advocate for chiropractic therapy, which uses spinal manipulation to decrease and alleviate her pain. What exactly is chiropractic therapy? Chiro means hand, and practice means practice, so it's hand practice. Evidence demonstrates that spinal manipulation along with heat, massage, and acupuncture are alternative pain-relieving methods in patients who experience acute and chronic pain. The National Center for Complementary and Integrative Health provide information related to spinal manipulation, benefiting people with headaches, neck pain, upper and lower extremity joint conditions, fibromyalgia, while also incorporating patients who have experienced whiplash-associated disorders. Chiropractics may be used in conjunction with ice and heat, electrical stimulation, relaxation techniques, rehabilitative and general exercise, diet, weight loss, and sometimes consuming dietary supplements. These are all concepts people should take into consideration when they decide if chiropractic therapy is appropriate for them. My teaching plan will be presented to patients who are 18 years or older at a pain clinic who experience acute or chronic pain. Due to the inability of pain medication to manage their level of pain adequately, these patients seek alternative sources to help alleviate pain. The goal of my presentation is that patients or family of patients will acknowledge the possible new alternatives for their acute or chronic pain. My cognitive learning objective is that patients will receive the educational material and be able to list 3 benefits of chiropractic therapy, and the patient will also be able to determine if chiropractic therapy is an appropriate pain alternative for them. My effective learning objective is that the patient will take the handout and the patient will ask questions regarding to chiropractic therapy. My psychomotor learning objectives is that the patient will be taught how to research chiropractic providers on the internet and teach it back to me, while the patient also schedules an appointment with the chiropractor. My learning objectives will be evaluated. The cognitive learning objectives will be evaluated if the patient is able to identify the benefits, 3 of them, of chiropractic therapy, and if they believe it will benefit them. The effectiveness learning objective will be evaluated if the patient accepts the handout regarding chiropractic therapy and is willing to share their possible questions regarding it. And lastly, my psychomotor learning objectives will be evaluated by if the patient reaches the chiropractor, contacts their office, and schedules an appointment by the next office visit if they are financially able. When taking a look at my handout that will be passed out to patients in the clinic, the handout provides information regarding the types of pain that a chiropractor can impact, from back, shoulder, neck, headache, and fibromyalgia. The handout also provides information regarding the use of natural agents such as heat, cold, water, massage, and exercise are utilized. It also says that patients who are on blood thinners or diagnosed with severe osteoporosis should consult their physician first. There may need to be multiple sessions for adjustments, and there's a narrow risk when therapy is provided by the trained professional. On the handout, it asks the reader to please consider the following. Ask your healthcare provider to decide whether chiropractic therapy is right for you. Chiropractic therapy may not be covered by your insurance company. Mention your past medical history and surgical history to your chiropractor. Inform the chiropractor of any medications, prescription or over-the-counter, and please tell about any complementary health approaches you may use, which are yoga or Tai Chi. For more information, down at the bottom, the reader can look on the National Center for Complementary and Integrative Health for more information, or they can also go to the Mayo Clinic and ask for more information. Both of these have contact information that they can contact if they have any questions. I believe that chiropractic therapy is a great way to decrease pain, and if patients were able to give chiropractic a try, they would be happy with their result of decreased pain. Thank you, and I hope you enjoyed.